We're a graduate school of the healing arts, 450 students in herbal medicine, acupuncture, transformative leadership and social change, and certificate programs in a lot of different spheres: food, social change, wellness coaching, health coaching. I practiced acupuncture for 35 years now, and some 30 years ago a man came back into me and he said, "I never thought asthma would be my friend." And I said, "Charlie, what are you talking about, asthma is your friend?" And he said, "Well, before I came to you, I was in and out of the emergency room. I was constantly on prednisone." He said, "Now I pick up the wheezing about 3 days earlier. And if I pay attention, I realize I'm overtired, I've had too much caffeine, I'm having a fight with my wife, and if I change the life circumstances, I don't ever get an asthmatic attack." And so that story has stayed with me. I've told it to virtually every patient since then, and found that people say to me, "Oh, my body's very smart. My migraine, if I pay attention, teaches me how to stay well." So that story changes the entire conversation about healthcare reform, which is trying to fix migraines or fix asthma. So if I say to somebody, you should drink a lot of water, then I'm the boss telling you what to do. When I say, observe what happens if you drink water, and you come back and you say, I'm not as depressed when I drink water and I walk, then you're empowered. And what patients have told us over the years, satisfaction in an interaction with a health provider doesn't come from the symptoms being relieved. We found statistically, satisfaction is related to, I now understand how I generate my symptoms. Now, if that pans out to be true, which we have evidence of, that changes the whole cost structure of healthcare. And I think Maryland is in a place to actually become a model state to move 75% of people out of a disease care system into a wellness system. And what the Tai Sophia Institute is training a wellness workforce for the state and for the nation. And TEDx is bringing together, TED Mid-Atlantic is bringing together a lot of people working at this from the terms of the quality of food, the quality of daily life, the quality of media, who now are merging. So these stories from different worlds begin to tell a tale that might create a very hopeful future for our grandchildren. Every day we get about 300 something people who come there who are in recovery from addictions, coming out of prison. And they come from 8 in the morning till 2 at night, so anytime somebody wants some support, they can get it. Well, the man who ran that up until a couple of years ago when he died, Al-Daha would say, he said, "Heroin is a very faithful friend. You want me off my heroin? Build me a friendship community." And that's what Al-Daha created there. A community where people can come together to keep themselves clean, support themselves. Now, spreading that attitude in Baltimore takes us away from a war on drugs into building communities of sustainable living, which I think I'm very excited at the conference about people talking about green farming in the city and using a labor force in the city that currently has no good source of employment. Imagine if we took that unemployed force that we now call folks who are addicted, build them a community where they can create something like a homegrown sustainable agriculture, and then we do that with the school kids so they grow up with that. So these worlds all intersect between the schools, the social problems, the crime, and creating new possibilities in community. Well, the lovely part of Baltimore as it exists right now is that it's grown out of a sense of a lot of ethnic communities coming together, the work of Jim Rouse, the building of Harbor Place. And I think now those silos are beginning to break down and people are really bringing their different skill sets, their different rituals. They're meeting each other, not around ethnic groups, they're meeting around social wellness. So I believe that in 15, 20 years, you're going to see a totally different Baltimore where it's thriving, but it is maybe the premier city in the country for sustainable local living. That we have turned around and created an environment that's favorable to good quality of children walking to school. Can you imagine if Baltimore went from where it is now, that I could send the grandbabies out at 8 years old and do what I did in Manhattan when I was growing up, and they can walk off to the school? I think that's possible, but it depends on building community and friendship alliances.